Hello, my name is Amy Sturkey. I am a pediatric physical therapist, and I wanted to talk about safe sleeping practices. So the research says that every year 2,000 babies die of SIDS, that's sudden infant death syndrome, and another 1,500 babies a year die of suffocation or strangulation or other unknown causes. So that's 3,500 babies a year that are dying. And I think it's really important as physical therapists and parents who have differently abled children be aware of the importance of safe sleeping. So a while ago they started with the Back to Sleep mission, and since children have started sleeping on their backs, there was a good decrease in the number of infant deaths. So there's both SID, sudden infant death syndrome, and there's sudden unexpected infant death. However, they found that they have to tweak it a little bit. Now it's an ABC. The baby should be alone, on their back, and in a crib. So I want to break down each one of those things. The first one is alone. Babies should room share with their parent, but not bed share with their parents. One of the most dangerous places for a baby is when they are sleeping in the bed with their parents. That's where a lot of SID deaths happen, because parents roll over, or the sheets go one way, go over the baby, or the baby is just less safe when he's in the bed with a parent. So they should be alone when they sleep. They're safest when their caregiver is their parent. Of course, that's no big surprise. They're safer with a parent than with a sibling or a grandparent or with a babysitter. They're safest with a parent who is not sleepy. Now, golly, that's tricky, because parenthood, and especially with an early baby, you are sleep deprived. They're safest if the caregiver is unaffected by drugs or alcohol or even drowsy-inducing medication. The research says that a child is 67 times more likely to die if they are sleeping on a couch, in a soft-sided chair, or on a cushion or on a mattress. That's whether they're being held by a caregiver or not. It's also important that the caregiver does not smoke. The babies do best if they're in a smoke-free home. So that includes fires in a fireplace, or candles burning, or incense. So that covers A pretty good. The next one is B. They sleep best if they're less likely to have SIDS if they sleep on their back. As you probably know, babies actually sleep deeper when they're on their stomach. So unfortunately, that makes they're on their stomach, so they're more likely to be in where they have their breathing obstructed, but they're sleeping deeply. So babies are safer if they're on their back. They're safer if their mother breastfeeds them. Interestingly enough, there is a 50% less chance of SIDS if a mother breastfeeds their baby. The research also shows that they are safest on their back, and if they are put one time on their side or on their stomach when they're used to being sleeping on their back, it's considered a very high-risk activity for them to then be placed on their stomach or on their sides, because they're not accustomed to being on their stomach, on their sides. The research says that they are more likely to have SIDS if they've had an illness in the last 2 to 3 weeks, especially if they had a fever with it. And they are more likely to have SIDS if they are less than 4 months of age. The last one is the C for crib. Children need to be sleeping in a crib. They should not be sleeping in a car seat or a bouncy seat. They can be in a swing and sleep, but it should be a totally flat swing. Because the research says that when babies are more upright and they sleep, that they are more likely to drop their head, and that could obstruct their airway and then die of not being able to breathe. The crib should be completely barren. There should be no bumpers, no blankets, no pillows, no stuffed animals, all the things that make the crib look really inviting, but that's when a baby is really in danger. It's important that the crib is flat. Some People think that if they incline the crib, if a baby has reflux, that they're safer, but the research says no, babies are always safer if the mattress is flat. It is very important that children are swaddled. There are two schools of thoughts on how long you should swaddle. One is when babies start to roll, they should not be swaddled anymore. And one school of thought is if they're swaddled, and you can keep swaddling them until they start to roll with the swaddle on. The other things that you have to think about is on your crib, it should be no more than 2 3/8 inch width in the crib. This means a soda can should not be able to go through that opening, or if there's a mesh side, that no more than a 1/4 inch opening should be in the mesh. Babies are actually safer if they have a pacifier, if they're put down with a pacifier. This is even if they spit out this pacifier, they're safer with the pacifier. They're not sure why that's true, but it is true. The pacifier should not be tethered in any shape or form. Babies, once they are no longer being swaddled, they can sleep in a sleep sack or other clothing, but they shouldn't have on more than one layer of clothing than you have on. Because babies, if they overheat or overcold, they're more likely to have trouble with their breathing. The room temperature should be 68 to 72 degrees Fahrenheit or 20 to 22.2 degrees Celsius. There are things that you can do to help prevent SIDS. Tummy time is really important because that helps develop the head and neck skill to be able to lift your head and turn it in case you do have some obstruction if you fall to your belly. But really the research says that you can do things that decreases the chance of SUIDs or SIDS, but you can't completely get rid of the risk. What they say is there's sort of a 3-level factors that go into sudden infant death syndrome. One is that babies in their first 6 months of life are growing and changing a lot. They're changing in how they're breathing, they're changing in their blood pressure, and so that puts them just inherently at risk for having problems. It's important to remember too that babies that are low birth weight or are born earlier than 37 weeks gestation, or babies who are part of multiples, so twins, triples, quads, they are more at risk for SIDS too. The next thing is some babies have genetic problems or neurological problems or cardiac problems, and unfortunately there are no tests for these things, but they often find when babies who have died from SIDS that they have one of those 3 issues. So you have the last thing is, so of the 3 things, their last thing is the external things. The things that we've been talking about of being alone on your back and in the crib, all those things are external factors. And often what happens when a baby dies of SIDS, that there is a combination of these 3 factors that have happened. So the things that you can really change are those external factors, which is why they're so important. As physical therapist, I do work with kids who have genetic problems, who have weak head control, who have neurological problems, or have heart problems. And so we are really in an important position to help bring home these facts that I have shared with you, the alone, the back, and in the crib, and all the other details of what we've talked about. Those are all really important for us to make sure we share this information with families, because 3,500 babies a year dying of SIDS is tragic. Anything we can do to reduce those numbers are really important. I hope this was informative and helpful for you, and we'll look forward to seeing you next time. Thanks a lot. Bye-bye. If you liked this video and would like to be notified by email when the next video comes out, click the subscribe button here and click the golden bell icon and ensure notifications are enabled on your account.